Hello, everyone. My name's Karen, and I'm one of the nurses from Cardiac Rehab. I'm also a nurse practitioner student, and as part of my doctoral project for my DNP program, I did a revision of the Cardiac Rehab Education Bundle. Now, although this lecture is not part of the weekly education topics in the revised education bundle, I strongly believe that having a basic understanding of the heart anatomy and physiology is essential, especially for our patients in cardiac rehab. So, I would like to present this lecture to supplement your learning and enhance your knowledge of cardiac anatomy. We'll take a friendly and approachable journey into understanding the heart and its functions. So, these are the contents of this presentation. We'll discuss the heart anatomy, its functions, and go over heart circulation and the heart's electrical system. We're also going to talk about things that can go wrong with the heart's electrical system, as well as some common heart diseases. So, heart anatomy. Now, the heart and the circulatory system, it makes up your cardiovascular system. The heart is a primary organ in that circulatory system. And the heart weighs between 7 and 15 ounces. And for those of you that use a metric system, it's between 200 and 425 grams. And it's a little larger than the size of your fist. It's located between your lungs, in the middle of your chest, right behind and slightly to the left of your breastbone, also known as a sternum. Now, some fun facts here. By the end of a long life, a person's heart may have beat more than 3.5 billion times. And in fact, each day, the average heart beats around 100,000 times, and it pumps about 2,000 gallons or over 7,000 liters of blood. Your heart receives nutrients through a network of coronary arteries. Now, these arteries, they run along the surface of the heart, as you can see in the smaller diagram in the presentation slide. The main coronary arteries are called the RCA, or the right coronary artery. We also have the LAD, or the left anterior descending, and the circumflex artery. The heart is divided into four different chambers. The upper chambers are called the left and the right atria, and the lower chambers are called the left and the right ventricles. There is a wall of muscle that extends from the top side of the heart to the bottom side of the heart, and that's called the septum, and that separates the left and the right side of the heart. So, just a little question here. Does anyone know the largest and strongest chamber in your heart? The answer is your left ventricle. The left ventricle is the largest and the strongest chamber in your heart. The left ventricle walls are actually only about half an inch thick, but they have enough force to push blood through the aortic valve and into the whole body. And speaking of valves, there are four valves that regulate blood flow through the heart. I'll show you another diagram that labels all of the heart valves and chambers, but for now, we'll just go over the heart valves. We have the tricuspid valve, and that regulates blood flow between the right atrium and the right ventricle. We have the mitral valve that lets oxygen rich blood pass from the lungs um, and pass from the left atrium and into the left ventricle. We also have the pulmonary valve, and that controls blood flow from the right ventricle and into the pulmonary arteries, which carry blood to your lungs to pick up oxygen. And then we have the aortic valve, and that opens the way for oxygen rich blood to pass from the left ventricle into the aorta and into the rest of your body. So in this slide, you can see that the different chambers and valves of the heart are actually labeled. Remember that your right side is blue and your left side is red. So you'll see major vessels like the superior and inferior vena cava on the blue side. You'll see the right atrium. You'll see the tricuspid valve and the right ventricle. And then we also have the pulmonary valve and the pulmonary artery. And on the red side, we have the pulmonary veins, we have the left atrium, we have the mitral valve, we have the left ventricle, and we have the aortic valve and the aorta, and you'll see a very clear picture there of of the aortic arch. Now we're going to talk about the main functions of the heart. So why is the heart very important? And the heart has three main functions. Its significant role is to pump blood throughout the body, and by pumping blood and allowing for blood to circulate in the body, it enables the transport of nutrients and oxygen rich blood to the cells, the tissues, and all parts of the body. It also helps regulate and maintain our blood pressure. So, in this diagram, I'll give you an overview of the blood circulation within the heart. And we'll start on the right side. Remember, your right side is the blue side, and your left side is the red side, okay? And can someone tell me why the right side is blue? And the answer, it's because this represents the blood that is deoxygenated. That means the blood that goes into that circulation, it starts off without oxygen because the oxygen was actually delivered to the rest of your body. So this deoxygenated blood, it comes from the body. It enters the right atrium through the superior and inferior vena cava. And from the right atrium, it goes through the tricuspid valve, and then it goes to the right ventricle. And then it's being pushed into the pulmonary arteries in the lungs. So why does it have to go to the lungs? The answer is to pick up oxygen. Right, remember that blood that goes into the lungs is deoxygenated. It needs to pick up oxygen to deliver to the other part of the heart. So now we're going to move over to the right side of the diagram, and that's the red side. So after picking up that oxygen from the lungs, the blood is going to travel back to the heart through the pulmonary veins into the left atrium. And from the left atrium, it goes through the mitral valve, and then it goes to the left ventricle, and then through the aortic valve, and out to the body's tissues through the aorta. So now we're going to talk about the heart's electrical system. In simplest terms, the heart is a pump made of muscle tissue. And like all muscles, the heart needs a source of energy and oxygen to function. The heart's pumping action, it's regulated by an electrical conduction system, and that coordinates the contraction of the various chambers of the heart. And we have discussed that in the previous slide. Normally at rest, as the electrical impulse moves through the heart contracts about 60 to 100 times a minute. That can also depend on a person's age. And remember that each contraction of the ventricles, not the atria, but the ventricles, and that represents one heartbeat. So moving along with the heart's electrical system, so how does the heart exactly beat? Remember, it all starts with an electrical stimulus. The electrical impulse, it travels from the sinus node. If you can follow me in the diagram here, it's on the top left corner. You'll see a little area there that's labeled sinus node. From the sinus node, it goes to the atrioventricular node, that's also known as the AV node. And that area is right between the right atrium and the left atrium, kind of like really close to the septum. So from that AV node, the impulses are actually slowed down for a very short period of time. And from there, it continues down the conduction pathway via the bundle of His, and then it goes through the left and right bundle branches and into the ventricles through the Purkinje fibers. So we're just gonna kind of go over it very quickly. Remember, it starts from the sinus node, and then it goes to the AV node, through the bundle of His, through the left and right bundle branches, through the ventricles, and to the Purkinje fibers. Under some abnormal conditions, there are certain heart tissue is capable of starting a heartbeat or becoming the pacemaker, just like the sinus node. An abnormal heartbeat, also known as arrhythmia, may occur when the heart's natural pacemaker or the sinus node becomes diseased and it slows down, or maybe the normal conduction pathway is interrupted, or another part of the heart takes over as a pacemaker. And that can cause either a faster or slower heartbeat. Symptoms of an arrhythmia can include feeling that your heart is either fluttering, some people may feel the heart palpitations, some people may feel shortness of breath. If it starts affecting your blood pressure, some people may get dizzy or even faint. So, now we're going to talk about some common heart diseases. Now, remember, the list that we have here on the slide, it's not all inclusive. I just want to put down some common heart diseases that we see here in the United States. And the most common form of cardiac disease in the US is coronary artery disease, also known as CAD or ischemic heart disease. And in some people, it can actually be the initial sign of CAD. Now, along with coronary artery disease, I just want to do a quick recap of a heart attack and what exactly is a heart attack. Now, a heart attack, also called a myocardial infarction. Sometimes you might hear terms like MI or myocardial infarction. Those are interchangeable terms or the same thing. So, what happens is that a part of the heart muscle doesn't get enough blood, so, the more time that passes without treatment to restore that blood flow, the greater the damage is to the heart muscle. Another common heart disease that we see is arrhythmia. Now, this condition happens when your heart beats either too slowly or too fast, or maybe in an irregular way. One common example is atrial fibrillation. Might also hear atrial flutter. And there are also some things like PAC, like a premature atrial contraction, or a PVC, premature ventricular contraction. And those things are not necessarily dangerous. However, when they start occurring too many times in a row, or it becomes very prolonged and it starts affecting other parts of your hemodynamics, like your blood pressure, that can cause someone to faint or have other symptoms. So that at that point, that becomes dangerous. Another common heart disease that we see in the United States is heart failure. And what happens in heart failure is that the heart actually becomes too weak to pump enough blood. Remember, the heart basically pumps that blood to support other organs in the body. It delivers oxygen and other nutrients to other parts of the body. So the heart becomes too weak. It doesn't pump enough blood anymore to support the organs in the body. And basically, people get into what we call heart failure. So remember this list, it's not all inclusive. There's a lot of other heart diseases. We have valvular problems and other conditions, and we can talk about that more during our exercise classes. You're more than welcome to ask me questions. And for now, that is the end of my presentation. These are the references for the slide deck. And thank you so much for listening. Again, my name's Karen. I will see you all during exercise class. Thank you and have a wonderful day.